the WSHA offices. We hope that you are well. We are sad to see that Mary Tyler Moore has passed today, but other than that, it is a day for moving forward. So thank you for joining us. As I said, this is Mary Kay Clooney-Roth. I'm WSHA's Vice President for Membership and Communications, and with me is Shalene Whitaker, who is our federal policy expert and lead on this. We want to give you some up-to-date information about what is happening in D.C. and how things are basically going to play out in our state. So thank you for joining us. We are going to honor your time as much as possible and not belabor this, but we do want to answer your questions. So if you have any questions, please feel free to use the chat box. You can also experiment with raising your hand on the phones. Finally, you can always reach Shalene or myself or Chris Bandelay if you would like to have a more in-depth conversation. Also, you may want to know that we are recording this, so we will put a link to it in tomorrow's weekly report so that you can share it with anybody else on your board, executive team, or staff who are interested in hearing about what we've got to say today. So that said, we are ready to get started. And I'm going to let Shalene, who is as I said, our federal policy expert and real genius on this stuff, give you a sense of what we are going to be doing today.
So we're going to, as Mary Kay said, we're going to give you the update of the latest activity on the Affordable Care Act, and really, I think, spend much more of our time around discussing our strategy and progress, and talk about what we are going to be asking you all to do in the next couple of months. And then we have some new resources that we want to share with you to support the work in your communities and with your boards and staff. So first things first, I know many of you are, just like us, are anxiously waiting to see what happens with the Affordable Care Act. And since we last talked, President Trump has been sworn in, and while he made no mention of the Affordable Care Act in his inaugural speech late Friday night, his office issued its first executive order on the Affordable Care Act to, quote, ease the burden of the ACA. And in it, he talks about that he gives federal agencies authority and discretion available to them to defer, grant exemptions, delay implementations of any provisions of the Affordable Care Act that impose any financial burden or cost, penalty, or regulatory burden on people and providers of health care. So while this is really, I think, more symbolic in terms of this executive order, I think it maybe indicates where the administration wants to focus its efforts moving forward in terms of trying to undermine pieces of the law. I'll remind everybody that executive orders, can't overturn federal law or the rulemaking that has occurred previously, but as a signal, this could really, I think we're looking at it as what could be the effects on the individual mandate in the future. And maybe some other pieces around if it could give states more flexibility around Medicaid. The rulemaking process in terms of changing rules will have to play out, so we will all have a chance to weigh in on that moving forward. So moving out of the president's office and thinking about what's happening in Congress, I think there's still a lot of, there's obviously a lot of talk about repeal, and now we've seen some of the first steps. And we saw a vote to move forward with a budget blueprint that, through budget reconciliation, instructs Congress and key committees to come up with repeal legislation. So this was done with, 51 votes in the Senate. They do not need to have the 60-vote majority in the Senate to move forward through budget reconciliation. And so we're really going to see that process in terms of instructing the committees to come up with a plan. I think we're going to start seeing that happen next week in D.C. And so if you're wondering if you've missed any of the policy details, no, that you have not. I think we still have yet to see proposals from either of those committees that I just mentioned that have jurisdiction over this area, or the Republican leadership, specifically pertaining to the Affordable Care Act. I will say that we have indications of where people are thinking, and elected officials are thinking that this could go. And recently we saw a proposal by two senators, Susan Collins of Maine and Senator Bill Cassidy of Louisiana, that would allow states a choice on keeping the Affordable Care Act operational in their states. Obviously, we would like a proposal like that, but that is kind of one thing that's been thrown out there, and really I think it's going to be politics that kind of wins at the end of the day in terms of is there going to be a plan that conservative Republicans in the House are okay with, along with a more moderate Senate. So you haven't missed any of the policy details. I think there's just a lot of talk about what could be done, but unfortunately we are waiting to see what will happen. And then in terms of the Hospital Association priorities in all of this, and turning our attention to there, I know that we did not answer very many of those questions about what happens next in the Affordable Care Act, and I think at this point we just don't know. So we're focusing on where our priorities are in this conversation and how we can be effective.
One thing I would say, when Shalene says we're waiting, I'd say it's not a passive waiting. It's we can't come forward with a bunch of policy analysis on policies that aren't out there yet. But as you'll see as we go forward, and we'll talk in more detail, we're having a ton of conversations. Unfortunately, none of those do what we most want, which is relieve our sense of anxiety and uncertainty. And I think that is something that is really common, and I'm sure it's part of the conversation in the GOP cloakroom as it is, for the Democrats is what are we really talking about here? And it is that uncertainty that is so disruptive in times like this. So it makes it really tough.
Yeah, thanks for that clarifying comment, Mary Kay. So our message continues to be similar to what you've heard previously if you've been paying attention around the Hospital Association and how we're trying to talk about what we've heard from Congress and the President. So our main messages are, it's preserving coverage. We have more than 700,000 people who have access to care through Medicaid expansion and who are receiving subsidies on the health insurance exchange. That's our #1 priority here. We are also concerned, as Mary Kay just pointed out, around the stability of the healthcare marketplace. Undermining the individual mandate and the effects of some of that could play out in very devastating ways, as our state saw in the 1990s around when insurance carriers became very concerned about the market regulations. So we are also concerned about making sure that we have an insurance market that's stable, but then also the stability for our own health systems to move forward in terms of caring for patients. The other piece here is around maximizing funding for the safety net programs. I think that our message is that, this could be around block grants or any other questions about what do you think about them. Well, at the end of the day, what does it mean for coverage? Are we going to be losing access to care and coverage because of cuts that are coming through different programs or different proposals? So we really want to maintain what we have here and potentially expand if possible, which doesn't seem likely in this scenario. And last but not least, we'll talk a little bit more about this, but if repeal of the law must happen, then replacement either must come first or simultaneously.
All right, so let's talk a little bit about what our approach to this work is, or what our strategy is around moving forward in this. Shalene, can you talk about how we're approaching this work?
Yeah. So right now we're getting asked a lot about how we are engaging on this issue, and as most of you know, or all of you know, the Affordable Care Act is an incredibly partisan issue. It was partisan when it was enacted in 2010. It remains so today. There are many differing opinions about it. And really our our position here is, in order for us to be an effective advocacy organization on behalf of our hospital members, we really need to be able to work with both sides of the aisle, the Republicans and the Democrats. And while we've been asked to engage in different partisan rhetoric, I think we've really tried to make it clear that we are about preserving coverage for the Washingtonians, and we're here to provide the facts and explain really what's at stake for hospitals and patients. So we're focusing on a nonpartisan, data-driven message, and we're really trying to be proactive about the information that we're getting out to our member hospitals as well as elected officials in these conversations. So what progress have we made?
Well, yeah, I mean, I think that what you're seeing now is a little bit different than what we were seeing in the immediate wake after the election. I mean, in the media calls that I took right after the elections, what is this going to do? You are still hearing a lot of talk about repeal, repeal, repeal. And as time has gone on and the reality of the new political situation has sunk in, you're hearing more folks, especially more Republicans, talk about, well, what are we really going to do to replace it? And that's where you get into the heavy, hard work of healthcare reform. And we've seen this happen over and over again. It is not easy to do this work. And the level of anxiety is growing, and some of it I'm sure is happening in the private rooms, but it's also overspilling into some of the public venues. So you see more and more headlines like the ones that we have posted here, where Republicans are really looking for solutions. And I think that they're doing that because they know it's the right thing. I think they're doing that because they're hearing from home about what's really at stake. I think a lot of folks know very well that the same people who said get rid of Obamacare knew that they also didn't want to lose their Affordable Care Act coverage, so that they know that there's a lot of folks, I mean, millions and millions, right, who are dependent on this care. So we're starting to see some progress, both based on what we think is our conversations, but also the voice that we're adding to others who are saying, what's the plan, what's the plan, what's the plan? There's just a ton of uncertainty that they've introduced, and actually, people don't really like uncertainty.
Yeah, and so as you can see by the headlines, we're starting to see this shift, and we've, as a hospital association, we've met with all of our congressional members, and we have an on-the-ground federal lobbyist back in D.C. named John Flink, who is also reinforcing our messages around making sure that we have a replacement plan if Congress moves forward with repeal. And I would say that generally, our messages have been, our congressional delegation has been receptive to our messages. In January, we also saw that the Seattle Times reported that our 4 Republican representatives, that would be Representative Rare, Butler, McMorris Rogers, Newhouse, and Reichert, have said that they, quote, that replacement in concurrence with repeal is something that they're interested in. So I think we're making progress. We need to keep up our conversations and our meetings, and we appreciate all of our members that have been engaging with our congressional delegation, your congressional delegation, at this point in time.
Yeah, and I would add to that we really want to make it easy for Republicans and for Democrats to take a nonpartisan, data-driven approach. So we feel like our approach makes it easier for others to follow by having it be a less charged message for what we're doing. But we also always look to partners to help do the work that we're talking about. So there's a ton of organizations all over the political spectrum who are concerned about this. I think we're in a unique space with a couple of other insurer and provider organizations where we have relationships with elected officials on both sides of the aisle, and not all organizations have that. I think what's more is that some organizations have a much broader healthcare agenda right now that they might be trying to continue to press or interject other changes that they want to make. And we're really focused on preserving coverage, but also the other parts of the Affordable Care Act that can move forward and that are nonpartisan. Other organizations want to preserve coverage, but they've got, something like single payer might be also in their agenda. So while there's some overlap, there's also some benefit to delivering different messages, different ways to different people. So we know that the statewide and local organizations and elected officials are going to ask for your support and endorsement on this topic. And so that's why we also want to talk for a minute about your work with partners. This can be a hard call sometimes because, of course, we do want to have great relationships with our elected officials, and saying no when they're asking for, a backdrop or for your participation can feel awkward. The risk, though, is that having your hospital's name linked to a really partisan event can make it hard to engage with lawmakers in the other party. It could make it that much more uncomfortable for them to hear your message and to repeat it. So if you're given an opportunity to support and engage your community conversation, League of Women Voters, Chamber, Rotary, something really neutral and where it's safe common ground for your community. If there's good bipartisan support and involvement, for example, if they're making real effort to engage lawmakers on both sides, then that might be a good opportunity to participate and to tell your hospital story. But if it feels a little bit more charged than that, you might think about engaging and supporting in some other less public way. So some things that you might think about as you take in those requests, and they come through your government affairs folks, through your PR folks, and sometimes even to your executives. Is it nonpartisan? How will your participation be perceived by others? And does the event or partnership really advance the cause? These can also, frankly, be time-consuming things. So you want to use your energy in a really effective way. So those are some of the things that we hope you think about. Shalene, you have thoughts on that?
Yeah, that's great advice, Mary Kay. I think the other piece that I would add is that if you ever want to talk through these requests or other information that you're being asked to provide, we at the Hospital Association are always here to help in terms of thinking about data needs, thinking about just the political piece, whatever you need, we're here.
I agree. So Shalene has a good sense of what's happening next. Yeah.
That might be
Okay, so maybe not what's happening tomorrow, but seasonally, what we're going to be looking at in the next couple of months.
Yeah, thanks, Mary Kay. So we think spring is going to be a really busy time for us in terms of our advocacy at the federal level. We are going to be, we continue to work with the American Hospital Association, who is really the national organization for hospitals. And we have good relationships with them, and oftentimes we really take our cues in terms of overall advocacy efforts for hospitals from the American Hospital Association. And so this is my plug for you to be paying attention for response to call to action. When we start seeing different proposals that are coming out from Congress that are going to have impacts to our preserving coverage goal, we're going to be asking you to engage. So please be ready to write emails, to call, to have meetings if there's time in terms of if the member's in district, and please engage on this because it's going to be very important. I think the other piece that we want to make sure that we're flagging for you is that continuing to engage with elected officials, having in-district meetings or meetings when your member is home. But also there's abilities to think about reporters or local editorial boards, and then signing on to maybe op-eds or placing local op-eds could also be an area that could be effective, and Mary Kay can help with that. Turning back to meeting with members of Congress, the next opportunity there, I think, for in-district meetings will be the week of February 20th, around President's Day weekend. Members will be back, and this would be a great time to talk about why preserving coverage is really the way to go. And John Flink, our federal lobbyist, who I mentioned is on the ground in D.C., he's also available to talk around what the latest is. If you're going out to D.C., he's happy to help arrange meetings there and prep you. So please use him as a resource in this, and remember that we're here as staff of the Hospital Association to also help with these issues.
Yeah, and I'd say one of the things that has really impressed me about being at WSHA, which all of a sudden is 4 years, is to what extent we can and will help with getting those. So even if you just like, I've never done a meeting with a politician before, really think about it, especially if you're in a Republican congressional district. They're really interesting. They're really fun. It's a great way to connect with the lawmakers. You do not need to be a policy expert. You're just talking about the benefits to your community. So really, John and Shalene have such extraordinary expertise on doing this. And Chris, too. I'm sorry, Chris is in a meeting in Olympia today, but he's also a huge part of this and knows these people very well and can help prep you both in terms of what kind of person am I going to be dealing with, but also what should I say or what should I not say. So you can go in, with a lot of confidence.
You can start thinking now about making any meeting requests for that in-district work period. That's the week of February 20th.
Yep, that is good timing because those times for them build up real fast. And frankly, there's so much happening in the federal level that I have a feeling that they're going to be besieged with requests. When you think about, EPA and holding up all the contracting, so they're going to be hearing from a lot of different organizations and agencies when they come home. So be sure to make sure that that this is part of their agenda when they get here. Again, you do not need to be waiting to do anything now. I think for one thing, you want to be having the conversation with your board and your staff leaders. While we may not be able to say, there's going to be block grants and this is how it's going to work and this is how we're going to have to prepare, what we need to do is start introducing into the conversation of what is going to happen next, the importance of preserving coverage, the work that we're doing to ensure the community has access to care, and how we're going to deal as organizations with uncertainty. So I think that's a real question. I think the other thing is the media. Reporters are really looking for different ways of telling this story. And it's hard to get patient stories, and I think I'm okay with that. I think we have stories as organizations. We've got clinic leaders. We've got folks who did outreach and enrollment just tirelessly for months and months and months. And they have stories, and we can tell those stories too. So start thinking about that. If you haven't been asked, how is the Affordable Care Act repeal going to affect you? Please start thinking about it. Are there clinic leaders who can talk about more expensive or less expensive treatment for chronic diseases, how that's playing out in your community? Are there doctors or nurses who helped get people enrolled and, save them from medical bankruptcy? I mean, in so many cases, being able to go on Medicaid has saved families, and we can tell those stories. Another big area is the changes that we've made to primary care. We all know that the healthcare system does not do a great job of getting people into primary care, treating their chronic diseases, eliminating the impact on those. Our only chance to improve that care system is if people have insurance and access to services and care. So we need to put those dots really closely together for people. The connection between coverage and care and health for the whole community needs to be really, and if I could think of a single sentence, I would give it to you, but it's as close together as you can make it. And I think that the stories that you all can tell and have told, frankly, in so many venues, to say we're making improvements on the quality of care. We're making people not get sick. Isn't that what you want us to do? And of course it is. So let's be thinking about that too. Be open to responding to media. God, I'm so happy to help if you get a question and you're not sure how to approach it. We know that a lot of the questions can feel very partisan or can be fermenting or sort of, hoping for some sort of strong anti-administration message. You don't need to go there. It's actually fairly easy to avoid. So we do want to help you with that. One of the other things that we have created that is a work in progress is a couple of PowerPoint slides. I think there's about 10 of them that you can take the content off of and use in your own organizations, again, either with your boards, community meetings, whatever you think is appropriate, that lays out the case a little bit for how expansion has helped us, what we're concerned about happening, what's at stake, and what our approach is. And so a lot of it is the content that we've kind of gone over here, but it's a very public-facing document. So we've got that, and if we don't have it quite yet on our website, we will have it on our website today, and that will hopefully help generate some conversations. And again, I'm totally happy to help you make it more personal, make it more reflective of your organization, make it more appropriate to the situation. You know, community meetings is something that I've had the opportunity to have a lot of opportunity to do, and I'm happy to help share that, especially for those of you in public hospital districts. This is something that you can start talking about publicly. And again, I want to remind folks that we are monitoring the chat box. So if you've got some questions, type them right in, and we'll either answer you directly, or we'll hopefully weave in an answer or call out the question in particular. But that is for you. I know that folks like to mute the phones while you maybe do a couple of other things in the middle of a webcast. Totally fine. That's why we have the phones muted. But we do want to hear from you. So if you've got some questions midway, go ahead and let us know. Was there anything you wanted to add to that, Shalene?
I think you covered most of it, right, Jay?
Cool. Oops, I jumped ahead. Sorry. So here's a couple of slides from our basic PowerPoint, and there is our website. And you can use it. You can link to it. You can request that there be new, you know, if you've got new questions or new content that you'd like to see up there. These are a couple of screenshots from the PowerPoint to give you a sense of the kind of information that we want to empower you with. But we are, you know, we're going to grow this, I think, as more data becomes available. And just as we hear from you, what is going to be useful to you and what's not useful to you. So again, you know, it's a bunch of slides. Use what you want, leave what you don't need. If there's more that you're looking for, let us know. The website also has some other additional statistics and things like that that you can draw from in any of your conversations. And again, we do hope that this that the information we're creating for you is very comfortable to be used in any audience. So if something really isn't landing well with your crowds, or you just feel like you need different kinds of information, we would love to hear from you so that we can get that right. You know, we're also talking with our many committees and our board about this too. So, for example, those of you on the Rural Hospital Committee will get the chance to weigh in on this next week, because we do want to make this so that it's useful and it's a good statewide message. And hearing from you is the best way for us to do that.
Great. So turning our attention to the American Hospital Association annual meeting, I think I will say one piece here. I think the previous slide talked about making sure that you're paying attention and willing to respond to messages in the spring. I think maybe I'm too optimistic when spring starts. We could actually be starting to see proposals on repealing and replacing the ACA you know, in the next few weeks to, you know, a month. So please be ready for those. But then focusing a little bit further down in actual spring, we all see the American Hospital Association has their annual meeting. This is each year they bring out all of the, this is a national meeting from colleagues around the country. They have speakers that are very high quality. They're talking about what's the latest in DC and also in terms of regulatory organizations. It really is a great meeting. It's a great chance to connect with you know, your hospital colleagues from Washington State, but also around the country. And one of the pieces that really is important for us in this meeting is that we arrange for our members to go on Hill visits and visit our congressional delegation in DC. And so we want people to consider attending. We make it easy for you to participate. We create the briefing materials and arrange the meetings, and you know, the hospitals are there to help deliver the message in terms of what's important. So please put that on your calendar, get your leaders involved, and we would love to see you back in DC.
And this is Mary Kay. If you have not gone to DC with this group, and you would like to talk to one of your peers who has, just to hear a little bit about the utility of the meeting and what might help you feel prepared to enjoy it, let us know, and we'll let you know who's gone on previous years so that you feel like you have a little more sense of it. Again, from a peer point of view, sometimes it's just nice to know. We're also happy to share who else is planning on going.
And then we also just got a question from a participant that asked if we are arranging any meetings to DC prior to the AHA annual meeting. And we know that the American Hospital Association usually puts out information about fly-ins in terms of asking their member hospitals to come to DC. I think we'll be interested to see if there's interest from our hospital members and leaders in terms of participating in those. So we will likely be asking some of the government affairs people when we see those fly-in dates from the American Hospital Association, because it'd be great to coordinate with an overall group. And I think really there the timing issue is kind of what the question becomes is when can you time this that, is there something new to respond to? I mean, we're continuing to have relationships and conversations with our congressional delegation, but I think that there's a timing piece around when it would be effective to go back to DC. So we will be in touch about that. That's my long answer to say that.
Well, and remember too that they're coming home, so it's a good opportunity, once they're here, to get them, in front of your board or in a meeting, at the hospital, or do any of those kinds of legislative visits. Only, with obviously members of Congress. To do that too.
Yeah, it's a lot easier to meet with them at your hospital than in DC.
Yeah, and they reach out to us too. I mean, some of you might have participated in a meeting with Congressman Larson, so they'll reach out to us sometimes and say, could you get a group together? And when that happens, we do email, let all the CEOs in that area know, so that there's opportunity for attendance there too. So that should save you some time. We know how valuable your time in the hospital is, and we want providing care to be your focus. But when your voice can make a difference on issues such as big as this, we want to make that possible. So just to summarize, here's some of the resources we have to support you. We are using both Inside Olympia and Inside DC to share information. Information about this webcast, for example, went to Inside Olympia list because we know that you are paying attention to Olympia as well, but we do want folks to know about it. We have regular conference calls with different groups at different times, just depending on what the issue is. So we do try to be thoughtful about that. But those of you on the roll call, this will be a regular topic of conversation. The committee meetings, our conversations with the federal lobbyists, et cetera. We do have the website, which we've got the link to right there, and experts ready to help. I mean, I think one of the things that's really extraordinary about WSHA is the number of people who are knowledgeable and are willing to come to your hospital, come to your community, address the issues, provide just an extraordinary level of expertise. And these are folks who are just really well respected across the state. And when you want want a sidecar folks to help carry a complicated message or deal with a tough audience, we're happy to come out and do that. And I'm happy to send Chris and Shalene and Claudia out to do that. Just kidding, I would come too, but I don't know as much. Sometimes it's helpful though. So anyway, we want to pause in all of our talking for any other questions, or if there's anything that, Shalene, did we leave out anything? Except for our crystal balls?
Yeah, that would be nice. A crystal ball would be nice. No, I think we're here to respond to questions if anybody has any at this point. Also take a look at the PowerPoint. It's up online. And we also have, I think, a couple different ways that we're engaging our memberships here. We have a federal call with some of our government affairs people. We have many of our committees that are also going to be talking about what efforts or proposals we're seeing from Congress in terms of our different active committees within WSHA. So I think there's a lot of different ways to get information, and we're here to help. So
yeah, I'd say one more thing, that if folks are thinking, how is this going to affect the state budget? That's obviously part of our regular legislative thoughts too, but there's no question that it will, but it's very hard to predict. So I think one of the things that's out there is, first of all, what's going to happen to health care funding with McCleary, and that is obviously one of our priorities is making sure that we don't see a lot of health care cuts. But also, the state is required to do some long-distance budgeting, and one of the pieces of analysis that we're going to stay on top of is what are the effects going to be on the states, especially expansion states, depending on what proposal they come forward with. But there's just so much uncertainty about that, we couldn't even come up with good fake numbers in order to have that conversation. So I think that that's one of the things that we're tracking, we're aware of, but we're not going to, sky is falling until there's some more information out there to work with. But it's also something we're watching with a fair degree of wariness.
Yeah, well said.
All right, well, listen, go out and conquer. It's also Burns Night. If you were wondering what else made today special, Robert Burns' birthday. Here we go. Thank you so much. And again, feel free to reach out to any of us if you have any questions, suggestions, or needs.
Thank you all for attending. Really appreciate it.